more. How are you doing today?
Okay, I guess.
Good. I'm just here to follow up on the surgery. We got the blood clot removed from your lungs. Do you have any questions for me while I'm here?
What are we going to do in the future to prevent the blood clots?
That's a very good question. We're going to go ahead and start you on a blood thinner called Warfarin, and we can talk more about that later. While I'm here, I'm going to go ahead and give you a quick assessment today. Is that okay?
Sounds good.
Okay, good.
Are you suffering from blood clots or a history of heart attacks or stroke? Ask your doctor about the drug Warfarin Coumadin. Warfarin is an anticoagulant drug used to prevent the treatment of blood clots or to prevent new blood clots from forming. The brand name for Warfarin is Coumadin. Its pharmacological class is coumarins. It helps to keep blood flowing smoothly throughout the body by decreasing the amount of clotting proteins. It interferes with hepatic synthesis of vitamin K clotting factors. Indications for Coumadin include prevention of strokes, DVT, pulmonary embolism, atrial fibrillation, and heart attack. Warfarin is contraindicated in patients with uncontrolled bleeding, open wounds, active ulcer disease, recent brain, eye, or spinal cord injury or surgery, and severe liver or kidney disease. Warfarin is not approved for women who are pregnant or planning to become pregnant, as it has potential to cause birth defects. Use of alcohol should be avoided by taking Warfarin, as it increases the risk for falls and bleeding. Excessive ingestion of foods high in vitamin K, such as green leafy vegetables, should be avoided, as it may decrease the effects of Warfarin. Risk of bleeding is increased in those with hypertension, history of stroke, kidney issues, cancer, or liver disease. Before starting Warfarin, tell your doctor if you are taking any drugs that could potentially interfere with the action of Warfarin. Some of these drugs include androgens, acetaminophen, beta blockers, dextrothyroxine, fluconazole, glucagon, influenza virus vaccine, NSAIDs, penicillins, salicylates, sulfonamides, thyroid hormones, and vitamin E. These drugs increase the anticoagulant effect of Warfarin and place the patient at an increased risk for bleeding. Drugs such as barbiturates, oral contraceptives, thiazide diuretics, trazodone, vitamin C, and vitamin K should also be avoided, as they decrease the anticoagulant effect of Warfarin. Warfarin is not recommended for everyone. Side effects include fever, diarrhea, rash, dizziness, fatigue, headache, edema, hypotension, nausea, vomiting, anemia, and difficulty breathing. Adverse effects include coma, intracranial hemorrhage, loss of consciousness, weakness, chest pain, intraocular hemorrhage, abdominal pain, hepatitis, hematuria, vaginal bleeding, potentially fatal hemorrhage, alopecia, ecchymosis, jaundice, pruritus, purple toe syndrome, tissue necrosis, and anaphylaxis. Initial dosage for Warfarin is 2 to 5 milligrams a day for 2 to 4 days, then 2 to 10 milligrams a day based on INR and PT results. Ask your doctor today about Warfarin and live the life you've always wanted.
Okay, good. That was all good. Do you have any more questions for me today?
No.
No? Okay, good. I'm going to go ahead and leave you alone for a little bit, and I'll be back later and we can talk about that Warfarin.